Holistic Evolution is a nonprofit, and we support the community's capacity to serve young men of color 16 to 24. We envision a world where young men of color are safe, supported, and resourced to live their optimal life. We do a number of population-based interventions, but then also individual-focused interventions. So when I say population-based, I mean things that will impact or affect the community as a whole, as opposed to just, young men of color. One of the things we do is the He-Man Healing Tour. Essentially, it's a number of innovative engagement opportunities that we do with young men of color, and each one has a different focus. So one of the things that we do is a barbershop talk. So we engage a camera crew, and we engage mentors and mentees, and basically we bring them into the barbershop with a mental health provider, and that mental health provider navigates the conversation around coping strategies, around mental health promotion, substance misuse prevention, around community violence, capture these conversations, and then we edit it, group them together in different subject matters. For instance, one of the experiences that we do is mental health promotion, suicide prevention. We do a substance misuse prevention one. But with suicide prevention experience, we have everybody in the room pair up, and we have them turn around and they put their backs against one another. We'll tell everybody to kind of change one thing about themselves, and then have them turn back around, look at one another, and then see if you can figure out what it is that your partner changed. But then we open up the conversation to start talking about suicide preventions or the signs and symptoms of suicide. And we explain, sometimes we see them plain as day, but sometimes we don't. And that's really impactful with the young men. Then we also do the Barbershop Health Initiative. So basically take healthcare providers into barbershops throughout the state of Indiana. They perform very preliminary screenings on the males that are in the barbershop and try to link them to resources. So that's our effort to address disparities in healthcare access. So when I submitted the Together We Will grant, it was after maybe 10 or 11 years of working with the state to put on the Indiana Black Barbershop Health Initiative. I felt like we could use the barbershops for so much more than just this one-day event once a year, right? I thought that was the perfect opportunity to really expand what it was that I was doing in the barbershop already. So we already had a pretty good following of the work that we do in the barbershop. And so I was just man, we could, train barber students as community health workers, and then they can facilitate these conversations in the barbershop with mentors, with other men. We used it, of course, to be able to send the young men through community health worker certification. We partnered with Lulu's Beauty and Barber College. So it was high school students that was actually getting their barber certification at the same time. So they were doing both. And then we partnered them with mentors that then basically invited their friends to the barbershop to have this conversation. We did the conversations on community violence prevention, substance misuse prevention, suicide prevention, and mental health promotion. So that's what we used funded for. I was excited to be able to expand. A lot of times with funding, they want you to implement evidence-based strategies or strategies that they already know about. It was very helpful that this funding, we were able to be innovative with it, that we were able to utilize what it was that came from this funding. We're still able to utilize this over and over again, So I thought that the increase in knowledge or the change in behavior would come from just those young men that went through community health worker training, that was engaged in the barbershop, But video recording this, sharing this recording, doing this experience over and over again, the He Talks movie experience over and over again, we've reached thousands of young men with just this initial funding.